When an extraction of a front tooth is planned for you, you do not have to go home without a front tooth. You could smile when you get out of the dental office. So in this video, you'll see one process where you could go home with a front tooth after a tooth extraction. Now, there are reasons why a tooth has to be extracted. One reason, especially in the front, and we see this on a regular basis, teeth are extracted because either there is trauma on the tooth that you cannot save that front tooth, or there is periodontal disease where the tooth is very loose, the bone level on that tooth is receded, and there is no more attachment to the tooth, so the tooth will be lost either by having the dentist pull that tooth out, or the tooth will eventually get loose so much that the tooth eventually comes out. So in this video, we are gonna go and show you how we plan to extract a tooth that is hopeless to keep. And the question will be, what can the patient do and what can they expect when they leave the office when a tooth is extracted? So the first thing we'll do is be able to assess this tooth. We will be taking an x-ray, and in this case, you'll see that this tooth has a lot of bone destruction and there's no more bone that's holding the tooth, especially in the front. It is critical that you have enough bone to hold the tooth so that you could keep the tooth for longer, and make sure that you're keeping an eye on how much bone is left to see if you could even save the tooth. But you could, as you can see here, the bone destruction is so much that the tooth is very loose. So this tooth has gotta go. Once we have assessed this situation and we've planned on extracting the tooth, the question becomes, what is the patient gonna have when the patient leaves the office? So if this is you, where you're getting a front tooth removed, you wanna make sure that you've got a tooth there in place when you go home, when you go to work. You wanna make sure that you have something there. There's a couple of choices that you've got. You're either gonna do an immediate dental implant or start to prepare that tooth for a bridge. But in this situation, we are gonna go ahead and deliver a partial denture to get that area healed before a more permanent solution for this patient for the front tooth. So in this video, as you can see here, we are preparing to extract the tooth. Now, the first thing that we're gonna do when we're extracting the tooth is make sure that person is numb. We go ahead and numb up the tooth. We'll go and make sure that all around the gums is numb so that when we take out the tooth, the patient, the person that we're gonna take the tooth out from, is comfortable. Now, there's a lot of ways to take out a tooth. In this situation, we're gonna go and use a forceps after we've loosened up the tooth and by severing the PDL, the periodontal ligament. And when we go ahead and take out a very loose tooth, it's not that hard to remove a loose tooth. So as you can see here, we're moving the tooth side to side until we can go ahead and remove that tooth nice and gentle so that we don't damage any of the structures around the tooth. After that, what we're gonna do is place the partial denture that we made previously so that the patient could go home with a partial denture in place, something that they're gonna go home with so that they could work, be able to be social with their friends, and go home with something in front of their teeth. So as you can see here, you've got a person, a missing tooth. One of the things that we've got to do for them is make sure that the partial denture that we made fits. The other thing that we have to be sure of is the patient has to have a way to put this partial denture in. It's not the easiest thing to do in the beginning, but it'll take, I would say, overnight, maybe a couple of days before you will be able to put that partial denture in so that it's not hard for you to do. We'll go ahead and give them direction on how to do this. We'll go and make sure that they're able to do it by themselves so that when they go home, they're able to take the partial denture out and then be able to go ahead and put that partial denture back in, and then make sure that that area that tooth was extracted is going to heal fine, so that later on we could go ahead and figure out what is it that they're going to do to replace that tooth. So now, like I was telling you, there are many ways to replace this tooth. One of the ways that this tooth could be replaced is with either a bridge, a dental implant, or a partial denture. So that choice could be made later, but the choices that we make here is to extract the tooth, and after we extract the tooth, what can be done when they go home. And in this situation, we're able to put a partial denture for one tooth so that they could go home and work, be with their family, go home and have a tooth in place after you took out the front tooth. So make sure that you watch the next video that we've got to explain other procedures that we do in a dental office, making sure that the patient is comfortable, making sure that they have made the right choices when they have a dental treatment. So make sure that you watch the next video and be sure to subscribe to our View Mobile Dental YouTube channel.